Hi, this is Dr. Jim Marcia, AOM Pharmacy in Albuquerque, New Mexico. This is the second in our series on hormone replacement therapy. And today we're talking about testosterone therapy for men. And we have spent quite a bit of time with both patients and providers explaining these products. And, you know, to our surprise, there's still a lot of questions about how the products actually work. The terms that we use, such as transdermal. The other issue that we've had with physicians in terms of prescribing is the dosing. Many physicians for years have dosed testosterone as an injectable prescription. It's usually done in the office, either with the physician or the nurse. The dose is normally about 100 milligrams injected per week of the testosterone cypionate, which is one of the injectable forms. It's an oil that's injected into the muscle. And a patient will come in either on a weekly basis or biweekly, or even at times, although we really don't recommend this, on a monthly basis for injections. 100 milligrams per week, 250 milligrams every 2 weeks, and so on. The problem with injecting this amount of testosterone into the body, even though you don't get all the testosterone in a single dose, it actually leaches into the body over a period of time, is that you tend to have very high serum concentrations at the start of the dose, and those concentrations will taper off and go very low at the end of the week or the end of the 2-week period. So you have very good results initially, and then slowly tapering off, and the effects tend to wear off over time. There's another issue with the injectable products, which is why we've switched to the transdermals, and is that with the injectable products, with your high concentrations at the initial part of the dosing, you're also going to get most of the side effects. Because serum concentrations tend to go very high, you're more likely to produce more estrogen as a byproduct of the metabolism of testosterone. So that's one problem. You know, testosterone is converted to estrogens at the higher levels, and so you want to be aware of that. If you are taking an injectable, you want to do some things that reduce the side effects of having high estrogen. So that's one of the side effects physiologically. And that side effect is actually very well known. It's well characterized in the literature. It's something that physicians and pharmacists have known about for years. But there's a second effect as well, with having these very high levels initially and then having them taper off in that manner. And it's an area that's often overlooked, and it has to do with your neuroendocrine system and how that functions. For example, these testosterone levels, when they become very high, there are tissues in the body, primarily in brain, that sense that. They sense those levels, and they respond in a certain way. The primary one is the hypothalamus and pituitary in the brain. And when you have very high circulating levels of testosterone, you're going to shut down the mechanism whereby the pituitary and hypothalamus reset, so that they reinitiate the physiological process to tell the body to start producing testosterone and other adrenal and gonadotropin, so gonadotropin hormones like testosterone. So you want to avoid this. You want to have these, you want to reduce the amount of testosterone that's in your body at any one time, because you don't want to shut down the pituitary. You don't want to shut down the hypothalamus, because it's a cascade effect. And eventually, over a period of time, you can diminish thyroid function, so metabolism will go down. You'll also diminish the thymus function. That's related too, so you'll have diminished immune function. And then also, finally, you will have diminished adrenal function, because your corticoid hormones will actually be affected as well. And so you'll have diminished cortisol, which will lead to adrenal fatigue, and chronic fatigue, and then ultimately you will have a reduced ability to produce testosterone from the gonadal tissues. So in men, that would be the testes. You want to avoid all that by having these very high serum levels of testosterone. That's where you get most of the side effects. So what we've done is we've introduced, by we I say that pharmacists and physicians are these transdermal products. And simply, what you simply do is you're introducing into the body on a daily basis a physiological level of testosterone. And the idea is that you're going to avoid all of those physiological adverse effects that you would experience with very high levels. So you take a physiological dose every day, and you're actually mimicking what your body is naturally doing all the time anyways. For example, the testes are producing testosterone. The testosterone and cortisol is primarily produced in the morning, so you'll have higher levels of testosterone in the morning and throughout the afternoon, and they'll taper off in the evening, and that's what you want. So you can actually mimic what the body is doing by using a transdermal product. And the other question is what is a transdermal cream? How is it produced, and what does it look like? And so I've brought this syringe here. It's a 5 ml syringe. This is the actual product. There's 5 mils of a 20 milligram per mil product. So 100 milligrams total. You would use 1 mil of this product every day. And again, it's to achieve a physiological dose on a daily basis. And it is a cream, and we'll show more about how the cream works and how it's applied in a little bit, but briefly we just wanted to show the product and give you some background information. It's capped. You would use 1 mil based on the graduations on the side of the oral syringe. Apply it to the skin, normally the forearm, or very close to the underside of the arm, where the tissue is relatively thin and well vascularized so that it absorbs well. So more about the details of transdermal testosterone in a minute, but this is what the product looks like. Let's go ahead and turn this off.